Endometriosis is an extremely common condition that affects about 30% of women of childbearing years between the ages of about 15 and 45. What we think happens is that during menstruation, some of the blood flows back into the pelvis, taking with it live endometrial cells, cells like those that line the womb. These cells are able to attach themselves to the peritoneal surfaces inside the abdominal cavity and grow new blood flow to themselves so that it can continue to proliferate. In the normal situation, the immune system will deal with these abnormal endometrial cells and they will be eliminated. But for some reason, in some women, this doesn't happen. Every month, as a result, these endometrial cells, like those lining the womb, are stimulated by the normal hormone cycle and ovulation, and they proliferate. When they proliferate, they may also bleed, they cause irritation. This irritation can cause fibrosis, it can cause adhesions to form, and these then in turn can cause pain, particularly if the endometriosis is associated with the nerve supply in the pelvis. Typically, this will be if the uterosacral ligaments are involved, as there are many nerves in that place. Endometriosis can also occur elsewhere in the body when we think it might be due to blood-borne spread. So it's not unusual for us to find endometriosis in relation to episiotomy scars that are from around the time of childbirth, maybe even in cesarean section scars, and sometimes people can even have endometriosis in the lung, although of course this is quite a rare situation. It's difficult to know how we should define the word serious in this context. Endometriosis isn't cancer, it's not going to kill you, but it is serious in the sense that it can give rise to really unpleasant symptoms. The typical scenario is a woman who's trying to get pregnant, and she's having difficulty getting pregnant. And at the same time, she's having pain having sex. And at the same time, her periods are very painful and difficult too. So you can imagine the situation. Every month, she's failing to get pregnant. Every month is very painful. And every time she tries to have sex, it doesn't really work. Not surprisingly, this can mean that it has a really big impact on women's lives. So it's definitely serious in that regard. And the women who have this condition can find it extremely frustrating. To add to the frustration, it's difficult to treat. And we often find ourselves in a situation where women are coming back again and again with endometriosis symptoms. This is probably because they're not being sent to the right specialist, they're not being treated properly, and the condition is never properly diagnosed or properly treated. And this is what makes it such a frustrating condition. So whilst it's not serious in the true sense of the word, it's certainly a serious problem for those women who have it. That's an interesting question. I think the main problem with endometriosis is that you don't know that you've got it. We know this because when we look at women coming to see endometriosis specialists, it normally takes about 4.5 years for them to get there. So women have pain, but they get pain with their periods anyway. They go and see their doctor and their doctor says, there's nothing very much wrong with you, perhaps take the oral contraceptive pill, go away and you'll be fine. They go away, things don't get better, they go back, maybe the GP suggests some other form of hormone treatment. Often basic tests aren't done, so the women don't know that they have endometriosis. If they don't have an ultrasound that sees endometriosis, if they're not examined to find out if they've got it, and certainly if they haven't had a laparoscopy to really check to see if they've got it, they don't know. And this can be the biggest problem that we face. Now, the commonest symptoms to look out for are pain, particularly associated with the periods, that perhaps comes on a few days before and goes on a few days afterwards. Pain during intercourse, because the endometriosis can be at the top of the vagina inside, and as a result, women will feel pain, particularly in particular positions, and always in the same spot. And the other thing to watch out for, of course, is if there's fertility issues associated with this. The pain that women get can also radiate down the legs because nerves are involved, and it can radiate round into the back as well and up into the loins. Having made a good diagnosis of endometriosis, we then have a number of treatment options at our disposal. If the condition is minor and isn't causing too much in the way of any problems, then probably we don't want to treat aggressively, and hormonal treatment then is the right answer. The simplest hormonal treatment would be to tricycle the oral contraceptive pill, that way diminishing the number of periods that you have, diminishing the amount of blood that gets deposited in the pelvis, and also diminishing the hormonal stimulation of the endometriosis that's already present. If we want to step up to a next phase of treatment, we might want to use some depo-progesterone. And this can either be given as the contraceptive injection or implant, or it can be given as a coil that's put inside the womb which has progesterone within it, the Mirena coil. The key, of course, is accurate diagnosis, and to do this we might well perform a laparoscopy to see exactly where the endometriosis is. And this gives us a unique opportunity to also excise it. And this is what we would typically do. Try to excise the endometriosis and then start with hormonal treatment in those women where the condition is serious enough. But if the condition isn't quite so serious, it won't be necessary to excise it. If it's really bad, maybe more than one operation will be required with hormonal treatment in between. So the treatment that's required is really very different from one person to another. And we also need to take into account what the patient wants to try and achieve. If pregnancy is the main thing, or if pain reduction is the primary thing that needs to be considered. There are a number of different treatments available, and the key thing when we treat endometriosis is that we look at the whole person. This really does need to be something where we are holistic in our approach. It's absolutely crucial that we listen to women and work out exactly what the goals of their treatment are. We know that this is a quality of life issue, and we know that fertility and pain are issues for all women. But what is their primary goal? Are we trying to cure the pain? Are we trying to improve fertility? If we're trying to improve pain, we may want to try and cut out all the endometriosis, and this may not be the smartest thing to do from a fertility perspective. If we're going for fertility, then perhaps what we need to do is to optimize our surgery to improve fertility. So I think the key to treating you as an individual with endometriosis is to listen and to set goals together so that we can get the best possible outcome.